I've known you for about 6 years or so.
Yeah.
And I know you first came in with lower back issues, and I know you'd had some surgery beforehand. When did that surgery happen?
I guess it's been about 10 years ago now.
10 years from the surgery, and they did a discectomy?
Mm-hmm.
Okay. What do you do currently in order at home? What are we doing at home to sort of help prevent back problems right now? What's your current setup?
The Dennerolls that you put me onto have been my best friend through the last 5 years,
Excellent.
6 years. So that's something that I definitely do on a regular basis. It's for me a good way to kind of get a barometer reading of how my back's moving, and so but it's been pretty good. You know, I'd say more mobile now than it has ever been, and it doesn't take as much time to do that stretching now. It's a little more maintenance ongoing.
Right. So being proactive, what we do is we sort of, what David's saying is keeping this area moving. We don't have to always be so aware and concerned with the lower back, and being sort of proactive instead of waiting for symptoms to occur before we treat it. And so today we're just going to go a little bit deeper today. I'm going to have you just start on your back for me. Breathe in deep. Exhale. Breathe in deep. Good. Breathe in deep. Exhale. Chin down. Good. All right. Breathe in deep for me. Exhale. Good. Other side for me. Good. Nice. Face up for me. Leg straight for me. I got you. There we go. Let that go. I got you right over here. Nice. There we go. Chin up for me. Nice. I know it was a while before we even did that side posture adjustment. My concern with people with lower back surgeries or any type of lower back disc injury is that when we're trying to do that side posture adjustment, you want to make sure that you're not adjusting L5. You want to make sure that the force is going into the sacroiliac joint. And, you know, even though you're contacting the SI joint, L5 is still going to move a little bit. And so, you know, if you can't adjust SI joint, the joint below L5, without moving L5, then I would argue you shouldn't be doing that adjustment. And so if anyone's ever experiencing lower back discomfort while they're doing that SI joint or middle back adjustment, you know, you gotta sort of let the practitioner know you don't want to be sort of aggravating the wound or putting your finger into a cut kind of idea. It's just gonna further aggravate it. There we go. Much better. Nice. When's the last time you've had any episode with your spine? I mean, has it been?
I think the last time was when I got off a long flight from Indonesia, about 2 days of flying, and then I thought it was a good idea to reach down and stretch and touch my toes, and I think I sprained a facet joint or something, and so
The lower back.
I just you know, a lot of times you can't feel if your back is tight, but had I spent some time on the Denneroll, I probably would have sorted that out. And
Yeah, the sitting is sneaky like that. It shifts all the weight to the non-sensitive parts, and you know, you feel up to do anything, and then when you bend forward, the joints destabilize. The ligament is what's holding the joint together. So the capsular ligaments get just mildly sprained. They're destabilized by bending forward. Good. top guy a little bit better. Okay, good. Just checking. I think we got them all. A little tiny more on that side. Yeah, there really shouldn't be any movement even on the second adjustment. Everything should move cold, right? No massage. We just go right in. And if all the joints are working on the first adjustment, you've got 99% of it. There's a tiny bit more movement. All right, let me have you sit up for me. Let your chin go down a little bit. There we go. I've got you pretty clean in here, David.
Mm-hmm.
I'm just going to check and see if there's any. A little bit right there.
I can say when I first came in, getting the adjustments and the massages and gua sha was very tender, and some
high sensitivity.
Yeah, and but since I'm getting everything moving, then it's more enjoyable.
Right. I tell that to my new patients, and they hardly believe me. I say this is eventually going to be something you look forward to, and almost, I would dare say, yearn for. You're almost yearn to get on to restore your body to where it's supposed to be, and it shouldn't be the end of the world to be in the right position. People sometimes will tell me, I'm here for a maintenance adjustment, and I'll examine their posture and it's terrible, or they're in a lot of symptoms and pain, and I go, why would you want to maintain this? Right? Let's get you to a position where you're feeling great. Just tilt your head a little bit that way. Let's get you to a position where you're feeling great, right? And then we'll maintain that.
Mm-hmm.
You're really at that point, to me, in what we call correction. We have to correct the problems. It's like if your house was, the air conditioning was blowing warm, or I'm just here for a maintenance. It's like, no, you're here for a fix. Maintenance would just be come in, check the freon levels, make sure that the compressor or capacitors are good. What do you have, a part-time AC job, Ed? Yeah, this is the model that I try to tell people how it should feel like. There's no, I have your arm back here, David, right? And it doesn't feel like ropes.
Mm-hmm.
The pec should be relaxed. Your arm should be able to come back, and the pectoralis is not contracted. If we're rounded forward all the time, then you just try to bring the shoulder back, and then there's bands in here. It feels soft. People, constantly when I work on them, this is like, a lot of tension in the front part of the shoulder. The brachial plexus is a bunch of nerves that are underneath the pec, and so as this is so tight, then those nerves get pressurized and your hands go numb if you try to bring your arms back or to the side, and that typically goes away in the first, few months to a year of stretching. You'll be able to have your arms, all in these different positions without 2 minutes your arms going numb. It's tension here on the front side, because nobody's really guided us to stretch our shoulders back, and life is filled with things that pull our shoulders forward, and there's no balance or counter stretching. Just a little bit here in the deltoid, right here on the front side.
How does that feel?
Good. I'm fortunate to have a wife that takes good care of me too, and we do the cupping at home,
Excellent.
and it's nice.
Yeah.
Shout out to Lonnie.
To Lonnie, yeah, I remember when Lonnie first came in here. She's from Bali,
West Java.
West Java.
Bandung.
And I remember asking her. I said, what treatment do they do in Java? And she said, massage and gua sha.
Mm-hmm.
Like it was something that was obvious.
Mm-hmm.
I'm like, there's no CVS or Walgreens, no.
She always tells me, "You lucky you have an Asian wife."
She's awesome. A little bit tighter right there.
Yeah.
Yeah, the left one feels great. This right side, right there, a little tighter. Yeah, it's the same kind of idea. We treat our teeth or our cars as prevention. You know, we in many ways prevention is way easier and less expensive in the long run if we maintain things than let things get out of hand. And so right now I'm scanning the shoulder, and there's really, it's like brushing teeth. Everything's clean, and if there's nothing dirty, I move on. If you find a little area of plaque, or lactic acid, you work on it and get it out of there, and you move on, live your life. But yeah, right there. You know, it's you can feel it. David can feel it, and it's internally there's muscle spasm, protection, old scar tissue injury, or just postural habit where the mouse hand, or who knows. But otherwise, this feels great, David. Very little. Back's pretty level. Did Lonnie introduce cupping to you, or did you do cupping long before Lonnie? Or
They would, typically use a coin and some tiger balm, and it's kind of things that everybody has. I wouldn't say she had any sort of special tool, but some sort of balm and a coin.
Okay.
And just kind of do some scraping.
Gotcha. I imagine it's a pretty decent sized coin.
Yeah.
I've used a spoon, or a jar lid in a pinch. There's really nothing magical. It's just combing the tissue, trying to. Maybe the best analogy is maybe like how a squeegee works on a car, to move water off the body of a car. Idea, right? If you used your hand, it wouldn't work the same as a squeegee.
Mm-hmm.
There's something about the combing that draws a lot of blood into the area and speeds up the replacement rate, and anything that's in the area that's tangled, or like trying to use your hand to comb your hair maybe is a better analogy. A brush is just way better. It's more fine. It's a way of untangling something way better than your hand. And so when you're using that brush on the fibers of the muscles, you can feel where there's catches, right? And the tissue shouldn't have any catches. It's like, no, the car shouldn't be dented, the hair should be combed. and we understand that entropy happens and that things go to chaos and you have to bring order to it. And that's really our purpose here, is to my dishes in my sink have never cleaned themselves yet. And my floors haven't cleaned themselves, my car hasn't cleaned itself. Work has to be put in. A little bit higher over here. What were your symptoms before they did the surgery?
It was strange. I had what I thought was a chest cold, but after sneezing or coughing really hard post-surgery with a lot of atrophy, and I did something, tore some soft tissues or something, and it felt like I had an elephant on my chest 24 hours a day. And when I went to the doctor, they said I was having a panic attack, and prescribed me medicine for that. And then so it's been a long journey from that, but those symptoms have largely resolved themselves. I had trouble sitting in any chair or laying down.
This was before the surgery or after?
This is after the surgery.
What were you feeling before the surgery?
So I had sciatic.
Just sciatic.
Mm-hmm.
So
Yeah.
I met you, 4 years post surgery, and
Mhm.
you were, let's say, so you're 38. How old are you now?
39.
So 39. So you were 29, let's say, right, when you had the surgery,
Mhm.
and so beforehand you had sciatica,
Mhm.
and then give me sort of more of how did it go the first year, or what was your impression?
Of seeing you.
Oh no, before I saw you, but the 4 years after your surgery,
After
and before I
surgery?
saw you, did you have any relief afterwards, or how long how much medication were you on?
So
Do you
yeah,
know?
so I mean, certainly I had some relief
Mhm.
from some of the
Mm-hmm.
the pain from the rupture, and
Mhm.
then but I had a lot of atrophy,
Mhm.
and like I said, I felt like just very brittle, and and when I did cough at one time, it was enough to, I feel, damage some soft tissues, which brought on a different wave of problems and symptoms, and
Gotcha.
I was kind of searching in the dark a little bit to figure out what was the cause, and
Right.
then so they had me on muscle relaxers and
Right.
pain anti-inflammatory and things like that, and I just knew that wasn't going to be a solution.
Right.
And I had done chiropractic before, but I think the main thing that you guys suggested me to do was have a demolition phase.
Right.
And that consecutive adjustments, I think it was like 5 or 6 days in a row of adjustments,
Mm-hmm.
was was educational, because I could get a sense of the progression, because it was in enough frequency
Mm-hmm.
that I could feel the movement happening. Whereas if I just went every time I wasn't feeling good and got an
Right.
adjustment at the chiropractor, I wasn't moving the ball in any direction.
Right. 2 steps forward, 2 steps back.
Mm-hmm.
I tell my new patients that we're trying to create a new wear pattern. So you can see his scar here. That's where they did the discectomy at L5, and so it's like the jelly comes out of the donut, and they wipe away the jelly, and maybe they scrape off some of the bone too. Now, his symptoms, you're still, when you cough, you increase intra-abdominal pressure, right? And so that's actually what we call that a Valsalva, is the orthopedic test where you sort of bear down or cough, and that increases the pressure, which can cause the disc to bulge again, or another part of the disc to come out and hit a nerve, or that's almost sort of the central nervous system. You're getting panicky, you said, right? Or there's a
Yeah, there's a tightness in my chest
tightness. Mm-hmm.
as well. So I mean,
Right. So,
I had bulging discs in my neck as well prior. So
and so the surgery, while it, gave you some relief, it doesn't stop the wear pattern. The pressure still goes down there. The things that cause that disc injury, mainly this area not moving, the tightness that you had here, the head alignment, all the things we talk about, right? Those were never addressed. If you just work reactively or just symptomatically, we never get to the cause, and then that usually, if we don't wind up in my office or somebody like me, it progresses to now the L4 or L3, and you move up the spine, and that's my nightmare is, but it's just keeping this area moving up here, fixing the problem, which is that this area should move before your lower back, right here, and this is what David does at home on the thing called a Denneroll, which is a orthotic, a molding device to keep this area moving. So you want to first have this area, what we called demo phase earlier, David, you want to have it first softened up. You can't reshape hard clay. So we first break down all these walls so that we can safely stretch without involving his injured area. And that's something that I think frequently happens, is people try to get on stretches and then they get hurt if you're not properly prepared for them. And I advise people to not stretch, usually for 3, 4, 5 visits or so until we got everything unlocked and moving, and then we can start safely stretching. Excellent. I say this all the time, but you can't age one area of your spine without not aging another area, and that's the balancing basis of my office. That you were 29, David, and this part of your back looked like a 45-year-old or 50-year-old or whatever. It was much older than you were, but in the same way, this area was 18, or hadn't aged. They were teeth that weren't being chewed on, and then there were some teeth that were being chewed on all the time, and balancing that work distribution. There we go. Do you remember how long you were on medication after the surgery? Hard to remember.
I would say maybe 6 months, and then I just knew it wasn't a solution, so I just quit them.
Gotcha.
Yeah.
I always think about that because it's like, how do you really know how you feel if you're on meds? I think that's sneaky. How do you feel? Well, I feel great. Oh, that's wonderful. Are you still going to be around to talk to me in 6 months when I'm off these medications? I remember talking to a lady one time who wasn't in my office, it was out in the street, and she was just asking me what I did, and she was telling me about her chiropractor that she went to, and she asked me, "Do you adjust under anesthesia?" And I said, "Well, no." I said, I hope that I could try to find the patient's limits, right, and go with what the patient can handle, right? I mean, it's a good, and then I want you to be able to tell me if I'm hurting your injured areas, right? So I don't want you totally numb. As uncomfortable as it might be sometimes to be worked on like this, it's important to be able to feel your spine so that you know if you're getting injured in the older parts of your spine. So she was like, "Oh, I see this guy, and he adjusts me under anesthesia, and he's just wonderful." And I'm like, okay, haven't. But part of what I'm thinking is, how messed up is your back that you can't handle an adjustment not under anesthesia, right? And she has to be there for 2 hours while they immobilize or numb her up, and I don't know. I think I would think a better way would be to just maybe not work so deep, and begin at a lighter level and ramp up to. It usually doesn't take too long. We can then work up to a level that's manageable, and then eventually there isn't any difficulty. But you just approach it from a, let's just numb you up.
There was a gal that I referred to you that she had a car accident, and she had a shoulder, she had nerve pain down her shoulder and to her arm. And she had said the same thing. She was getting the injections to kill the pain, but then she said she believes her patterns of movement were, she wasn't feeling the pain.
Correct,
to keep her from moving it, so she was aggravating the nerve even more.
Right.
And
it's really what leprosy is. Leprosy is a bacterial infection in the nerve, and the nerve is unable to transmit signals, or the brain can't properly feel your body. And so what ends up happening is most of the damage to your body isn't from the bacteria, it's from your inability to feel your own body. So you go to itch your face, and you don't realize how much pressure you're exerting, and you end up damaging yourself, right? Or you're standing by a fire and you don't realize that your skin's actually burning, but you don't actually feel what's happening. So we demonize pain sometimes in America, and I go, well, that pain is actually preventing you from, it's letting you know that something's wrong so that you can stop what you're doing. And we have an entire discipline devoted to helping people disconnect from that.
Another thing they don't tell you about the anti-inflammatories is that though it may stop the inflammatory part of it, it also stops the anti-inflammatory response to the inflammation.
Right. Yeah, slows healing. That really inflammation's your body trying to speed up the replacement rate. Now, if you're damaging yourself faster than your body can replace, you're chronically inflamed, and that's where sort of inflammation gets a negative connotation or a bad rap, because I'm chronically inflamed, and so now I need to get some anti-inflammatories to help deal with this. And I'm combing you as hard as I can here, David. I mean, there's some, but this is. When I was a boy, my dad and I took a run around the neighborhood, and how all competitions start. We began at a brisk walk, and then it became a trot, and then a jog, and then we're by the last leg of this sort of trip we were making. Now we're at a full-blown sprint, right back to the house, because my dad and I are very competitive, and so I don't know how old maybe I was like 12, and so he's taller than me, and so I think he definitely had a higher top speed, let's say. I'm wearing flip-flops though, and he's wearing shoes, and so my dad would always, shoes and socks and no flip-flops was his sort of. Anyway, so I'm gonna try to beat him now in flip-flops. He's running. He's pulling ahead of me at that last little leg. And my neighbor, our neighbor when we grew up, had this large oak tree with real low branches, and so at the last second I sort of darted across my neighbor's lawn to get to the front door before my father, right? And so the last name of this guy was Ulrich, and so it was like, so it's sort of a joke. Dad will say, you're gonna cut across Ulrich's lawn again? It's like a way of. But anyway, we get home. The reason I'm saying this is that my dad takes his shoe off, and he had a white sock on. I'll never forget this. It was like covered in blood when he took his shoe off, and I remember thinking like, Dad, are you okay? And he had no pain. He was like, and this is from that nerve damage that most people feel nerve pressure, right? We have pressure on nerves. What you were experiencing was nerve pressure. There isn't actually, the actual nerve itself is not damaged. It was being irritated. It actually was functioning properly. My dad has nerve damage whereby the brain can't communicate with part of his leg, and that area was being physically damaged. I think the sock was not on properly, and so it was causing a friction inside of his shoe between the sock and his shoe and his foot, and he had a blister, and maybe I was 10, and I remember just obviously seeing that much blood. You're like, okay. It has a vivid image of that, and understanding at that age the importance of being able to feel your own body is my point. And I remember, I was like, Dad, how could you not feel that? Why wouldn't you stop running? Why wouldn't you stop doing what you were doing that was. And my dad's like, oh, I can't feel that part of my leg, Ed. I'm sure at that age I was like, why? What do you mean you can't feel it? My dad would just call it his dead leg, part of his dead. The S1 dermatome was damaged from essentially over manipulation in an area of injury. My dad was injured permanently, sort of when he was in school, and that's sort of the foundation for why we leave this area alone. Comes from my father. That's where'd you learn this? From my dad being injured. It's a sad, sort of a sad foundation, but it's that same benefit, the same ability to get injured here can be put in other areas to give so much benefit.
Well, who run the race?
I did. Yeah, no, that because I cut across Ulrich's lawn. My dad claimed I cheated. You know, I'm like, it's totally fair game. I did the, you know, almost, probably my hands touched the ground. I probably almost had to crawl underneath this tree, but it provided at least a 25 foot, you know, decrease in distance, total distance by cutting across the lawn. And so, you know, there's no way my dad would have been able to, you know, it would have been branches in the face, and, you know, he was not going to become 2-3 foot tall to get underneath this tree. There we go. It's just a little tiny bit here on glute medius.
Mm-hmm.
Really not much. This is just smooth. There's no speed bumps. I think of it like a highway. There shouldn't be any speed bumps on the highway. This joint should be moving effortlessly. Excellent. You know, when you have lower back nerve pressure, these nerves control the glute, and so you'll get tightness in your leg or symptoms in the leg, and it's really from the false activation, or the brain's not sending the signal, the nerve is irritating your lower back, and then the muscles are receiving a signal to contract, and so there's tightness and symptoms, but it's from nerve irritation here. And so until you relieve the pressure on the nerve, there really can't be any permanent change. So cleaning this area out is how you desensitize the nerves, prevent symptoms. And so proactively sort of checking these areas, making sure there's no buildup. All right, so what we're trying to do here, David, is we're trying to just sort of take you into extension like you're on the Denneroll, and then we're going to adjust your middle back while you're in extension. So most of the adjustments are done in a neutral position. This one we're going to sort of bring you into extension. This is not a lower back adjustment. We're really not trying to involve this. We're just trying to further loosen the middle back. I got your legs. Okay, if you have any lower back discomfort, let me know. Breathe. There we go, it already moved. Just holding. There we go. Good. There's one right there. He's so loose, it's not even going to take. Very good. You okay? Okay, very good. Beautiful. It's already good. Very good. I mean, it's just, and even there wasn't much strength required to get your legs up, David. There's not much resistance in his back. You okay? Very good. I'm gonna bring your arms up. We'll do one more. I'm gonna show you. This one's put your forehead on your forearms. Put your forehead on your forearm. There we go. Good. So it's the sort of the same idea. And just relax your back. I got you. All right. Breathe in deep for me. Exhale. Good. Breathe in deep. Exhale. Good. You okay? Breathe in deep. Exhale. Good. It moved. Yeah. You okay? Very good. No, you did great. I call those the bow move. There we go. Good, very good. You know, it's nice and smooth. Look how just you know, it's not strength that allows someone to arch back like that. It's no resistance. There shouldn't be any resistance to going into extension. Very good. Good, very good. All right, let your leg go. I got you. Good, very good. Nice and loose?
Loose as a goose.
Excellent, thank you.